Today, we are diving into allergy and anaphylaxis, a crucial topic that every EMT must master. Allergic reactions range from mild to life-threatening, and it is essential to recognize the signs early and act quickly. We'll explore the immune system's role, common allergens, anaphylaxis, assessment strategies, and emergency medical care. By the end of this lesson, you will have a solid understanding of how to assess, manage, and treat patients experiencing allergic reactions. Let's get started. The immune system serves as the body's defense mechanism, protecting against foreign substances and potential threats. When an unfamiliar substance enters the body, the immune system responds by attempting to neutralize it. Most of the time, this process keeps us safe. However, in some individuals, the immune response becomes exaggerated, leading to allergic reactions. In this section, we'll examine the key players in this response, including histamines and leukotrienes, which drive allergic reactions and anaphylaxis. An allergic reaction is an exaggerated immune response to a substance that is typically harmless. This reaction is not caused directly by an outside stimulus, but rather by the body's own immune system overreacting. When the immune system identifies a substance as a threat, it releases chemical mediators like histamines and leukotrienes, which trigger the classic signs of an allergic response: swelling, redness, and difficulty breathing. Let's explore how this response can range from mild to severe. As EMTs, it is important to remember that not all patients will know what is causing their allergic reaction. Some may be experiencing an allergic response for the first time. This means we must stay vigilant, recognize the early signs and symptoms, and always maintain a high index of suspicion. An allergic reaction can be mild and localized, such as an itchy rash, or it can be severe and systemic, leading to anaphylaxis. Early identification is key to preventing deterioration. Anaphylaxis is the most severe form of an allergic reaction. It is life-threatening and requires immediate intervention. Unlike a mild allergic reaction, anaphylaxis affects multiple organ systems, leading to airway compromise, circulatory collapse, and shock. If not treated promptly, it can result in death within minutes. Our job as EMTs is to identify anaphylaxis quickly and administer life-saving treatment, such as epinephrine and oxygen therapy. Let's take a closer look at the physiological process behind anaphylaxis. One of the most common signs of an allergic reaction is urticaria, or hives. This appears as multiple raised areas on the skin that may itch or burn. These welts can spread across the body and are often one of the first warning signs of a more severe reaction. While hives alone are not necessarily dangerous, their presence should alert EMTs to closely monitor the patient for any worsening symptoms, such as airway swelling or difficulty breathing. Another major sign of anaphylaxis is angioedema, or deep tissue swelling. This is particularly dangerous if it occurs in the face, lips, tongue, or airway, as it can lead to obstruction of breathing. Wheezing, a high-pitched, whistling sound heard during expiration, is also a critical indicator of airway involvement. If you encounter a patient with these symptoms, it is essential to act quickly to ensure their airway remains open. Beyond skin and airway symptoms, anaphylaxis can cause stridor, a harsh sound heard on inspiration, indicating upper airway swelling. The patient may also experience hypotension due to widespread blood vessel dilation, leading to shock. Additionally, nausea, vomiting, and abdominal cramps can occur. It's important to understand that anaphylaxis can affect multiple body systems at once, so rapid assessment and intervention are necessary. Food allergies are among the most common triggers of severe allergic reactions. Shellfish, nuts, and dairy products are frequent culprits. Medication allergies, particularly to antibiotics like penicillin or non-steroidal anti-inflammatory drugs, can also be dangerous. It's important to note that food allergies may take up to 30 minutes to present symptoms, whereas injected medications can trigger reactions almost immediately. Some individuals are allergic to pollen, dust, or plant materials, such as ragweed or oak. Additionally, chemical exposures, including certain soaps, cosmetics, and hair dyes, can trigger reactions. Latex is another concern, particularly for healthcare workers. If a patient has a known latex allergy, nitrile gloves should always be used instead of latex gloves. Approximately 2 million Americans are allergic to insect venom, and reactions to stings account for at least 62 deaths per year in the US. Some individuals may experience an anaphylactic reaction, even if they have never had a reaction before. Bees, wasps, and hornets can all deliver venom through their stings. Fire ants, unlike bees, can sting multiple times, injecting venom at several sites. If a patient has been stung and develops breathing difficulties, swelling, or hives, immediate treatment is required. In severe cases, patients stung by insects may experience rapid-onset anaphylaxis. Signs include stridor, wheezing, chest tightness, severe anxiety, and hypotension. If left untreated, these reactions can quickly result in respiratory failure and death. Because anaphylaxis progresses so rapidly, EMTs must act without delay, ensuring airway management, oxygen administration, and epinephrine injection as needed. Insect stings are a common cause of allergic reactions and anaphylaxis. Approximately 2 million Americans are allergic to the venom of bees, wasps, and hornets. These reactions account for at least 62 deaths per year in the United States. What's particularly concerning is that about half of these deaths occur in individuals who had never experienced a severe reaction before. This means that even if a patient has tolerated stings in the past, they may still develop a life-threatening reaction in the future. The way an insect stings can influence the severity of a reaction. Honeybees have barbed stingers, which remain embedded in the skin, continuing to inject venom until removed. In contrast, wasps and hornets have smooth stingers and can sting multiple times. Understanding these differences can help EMTs determine the risk of envenomation and the urgency of care. This slide shows the key differences in insect stingers. The honeybee's stinger is barbed, meaning that after a sting, it stays lodged in the patient's skin, releasing venom. However, the wasp's stinger is smooth, allowing it to sting repeatedly. Because wasps and hornets can attack multiple times, patients who encounter these insects may sustain multiple venom injections, increasing the risk of anaphylaxis. Fire ants are another significant threat. Unlike bees or wasps, fire ants do not rely on a single sting. Instead, they bite and inject venom at multiple sites. This can cause severe skin reactions and even lead to anaphylaxis in highly allergic individuals. Fire ant bites typically occur on the feet and legs and appear as clusters of small, raised pustules. If a patient has multiple fire ant bites and is showing signs of a reaction, monitor for difficulty breathing, swelling, or signs of shock. A patient who has been stung may experience a localized reaction or a severe, systemic reaction. Local reactions include pain, redness, swelling, and itching at the sting site. However, more concerning are systemic reactions, which can rapidly progress to anaphylaxis. If a patient develops symptoms beyond the sting site, such as difficulty breathing, hives, swelling, or dizziness, you should suspect a severe allergic reaction and prepare to administer epinephrine. In severe cases, anaphylaxis from an insect sting can lead to respiratory failure. Without prompt treatment, anaphylaxis can progress to death within minutes. Statistics show that over 2/3 of fatal anaphylactic reactions occur within the first 30 minutes. This means that early recognition, epinephrine administration, and rapid transport are essential for saving lives. If a patient exhibits signs of stridor, bronchospasm, wheezing, hypotension, or loss of consciousness, immediate intervention is required. As EMTs, our response to an insect sting emergency should follow a structured approach. First, ensure scene safety and remove the patient from further exposure to the insects. If a stinger is present, remove it by scraping it off with a rigid object, such as a credit card. Never squeeze it, as this can inject more venom. Apply a cold pack to reduce swelling and pain. If the patient has a history of severe reactions, assist them in using their epinephrine auto-injector if indicated. Finally, always transport the patient for further monitoring, as symptoms may worsen or return after initial treatment. When responding to an immunologic emergency, always begin with scene size-up. Look for potential allergens, such as insect nests, food, medications, or plants. The patient's environment or recent activity may provide critical clues. Ask if they were recently stung, ate a certain food, or started a new medication. Also, be mindful of other potential causes of respiratory distress, such as trauma, infection, or toxic exposure. Protect yourself by following standard precautions, including gloves and eye protection, and consider calling for ALS backup if the patient appears critical. In the primary assessment, your goal is to quickly identify and treat any life-threatening conditions. Form a general impression by evaluating the patient's level of distress. Are they anxious, struggling to breathe, or showing signs of shock? Check for a medical alert bracelet that may indicate a known allergy. If the patient appears to be in severe respiratory or cardiovascular distress, call for ALS backup immediately and prepare for rapid transport. In the primary assessment, our top priority is to quickly identify and treat life-threatening conditions. Anaphylaxis can present as severe respiratory or cardiovascular distress. Patients may appear extremely anxious, struggling to breathe, or showing signs of shock. Always assess for airway, breathing, and circulation, ABCs, immediately, as rapid intervention may be required. If available, call for ALS backup to provide advanced airway management and medication administration. Anaphylaxis can cause rapid airway swelling, leading to complete obstruction within minutes. As an EMT, you have only a few minutes to assess the airway and provide life-saving measures. If the patient is having difficulty speaking, breathing, or swallowing, act immediately. A patent airway is critical. Without intervention, the patient may lose their airway and go into respiratory failure. To quickly determine the severity of respiratory distress, assess for signs such as increased work of breathing, use of accessory muscles, head bobbing, tripod positioning, nasal flaring, and abnormal breath, sounds like stridor or wheezing. If any of these signs are present, initiate oxygen therapy immediately and prepare for possible airway intervention. Positioning plays a key role in patient management. If the patient is experiencing respiratory distress, place them in a high Fowler's position to maximize ventilation. However, if signs of shock are present, such as hypotension or altered mental status, the patient should be placed supine to help maintain circulation. Do not delay high-flow oxygen administration via a non-rebreather mask. Anaphylaxis does not just affect the airway, it can also cause circulatory collapse. Assess for hypotension due to widespread vasodilation, weak or absent radial pulse, cool, cyanotic, or pale and clammy skin, and delayed capillary refill. If you detect signs of shock, immediate treatment is necessary. This includes laying the patient supine, maintaining body warmth, and administering oxygen. The only definitive treatment for anaphylactic shock is epinephrine. Epinephrine constricts blood vessels, reversing hypotension, and reduces airway swelling, allowing for better breathing. If the patient has an epinephrine autoinjector, assist with its use. If symptoms persist, additional doses may be required based on local protocols. Rapid transport is essential, even if the patient shows improvement. Always provide prompt transport for any patient experiencing an allergic reaction. Even if symptoms appear mild at first, they can worsen rapidly. Patients experiencing respiratory distress, hypotension, or altered mental status should be transported without delay. Anaphylaxis has the potential for biphasic reactions, meaning symptoms may return even after initial improvement. For this reason, all anaphylaxis patients require hospital evaluation. After the primary assessment, the next step is gathering a thorough history. Begin by asking about the patient's chief complaint and the history of the present illness. Determine whether the patient was recently exposed to a known allergen and what symptoms they are experiencing. Some patients may not immediately recognize their allergen exposure, so asking detailed questions is crucial in identifying the cause of the reaction. To obtain a complete picture of the patient's condition, use the sample history method. Ask about the signs and symptoms they are experiencing, any known allergies, and whether they are taking any medications. It's important to find out if the patient has had allergic reactions in the past, as a history of anaphylaxis increases the risk of severe reactions in the future. Ask when they last ate and what events led up to the allergic reaction. The more details you gather, the better prepared you will be to treat and transport the patient. To obtain a complete picture of the patient's condition, use the sample history method. Ask about the signs and symptoms they are experiencing, any known allergies, and whether they are taking any medications. It's important to find out if the patient has had allergic reactions in the past, as a history of anaphylaxis increases the risk of severe reactions in the future. Ask when they last ate and what events led up to the allergic reaction. The more details you gather, the better prepared you will be to treat and transport the patient. Be alert for statements about food intake, as food allergies can cause symptoms that extend beyond the airway and skin. Many patients with food allergies also experience gastrointestinal symptoms such as nausea, vomiting, diarrhea, or abdominal pain. These signs indicate a systemic reaction that may progress to anaphylaxis. If a patient reports stomach pain or nausea along with hives or swelling, be prepared for possible deterioration and the need for aggressive treatment. After gathering the patient's history, perform a focused physical exam. Begin with a head-to-toe assessment, looking for visible signs of an allergic reaction. Pay close attention to any swelling of the face, lips, tongue, or airway. Check for abnormal breath sounds like wheezing or stridor, as these may indicate airway compromise. Inspect the skin for hives, swelling, or rashes. Even if a patient appears stable, a detailed physical exam is essential to detect early signs of deterioration. Assess the patient's baseline vital signs, including pulse rate, respiratory rate, blood pressure, and oxygen saturation. Anaphylaxis can cause hypotension due to widespread blood vessel dilation, a rapid heart rate, and difficulty breathing. Be aware that skin signs may not always be reliable in determining perfusion, as anaphylaxis affects multiple organ systems at once. If the patient's blood pressure is dropping and their pulse is weak or thready, they are in shock and require immediate intervention. If available, use pulse oximetry to assess the patient's oxygen saturation. However, do not rely solely on monitoring devices. Always prioritize clinical assessment. Oxygen therapy should be given based on signs and symptoms, not just pulse oximetry readings. If the patient is showing signs of severe respiratory distress, prepare to assist ventilations with a bag valve mask and ensure rapid transport to an advanced care facility. Patients experiencing an allergic reaction require frequent reassessment. If the patient is unstable, reassess every 5 minutes. If they are stable, reassess every 15 minutes. Continue monitoring for signs of shock, respiratory failure, or worsening airway obstruction. Symptoms can progress rapidly, so never assume a patient is out of danger just because they initially appear stable. After providing treatment, continually reassess the patient's response. If epinephrine was administered, check whether their breathing has improved and if their blood pressure is stabilizing. If symptoms persist or worsen, additional doses of epinephrine may be needed based on local protocols. If the patient is not responding to treatment, prepare for aggressive airway management and rapid transport to a hospital. Accurate documentation is essential in immunologic emergencies. Record the patient's symptoms, vital signs, treatments provided, and their response to interventions. Be sure to document any medication administration, including the dosage and time of epinephrine use. When transferring care to hospital staff, provide a clear and concise report, detailing what treatments were given and how the patient responded. This ensures continuity of care and helps guide further treatment. If the patient was stung by an insect, carefully remove the stinger if it is still embedded in the skin. Scrape it away using the edge of a credit card or similar object. Never squeeze the stinger, as this can inject more venom. Wash the affected area with soap or an antiseptic. Remove any jewelry near the site to prevent constriction from swelling, and apply a cold pack to reduce inflammation and pain. Even if a reaction seems mild at first, continue monitoring for signs of anaphylaxis. Be alert for airway swelling, respiratory distress, and changes in mental status. Place the patient in a supine position if they are in shock and provide oxygen therapy as needed. If symptoms progress, immediate intervention with epinephrine is required. Epinephrine is the first-line treatment for anaphylaxis. It works by reversing airway swelling, improving blood pressure, and reducing bronchospasm. Epinephrine autoinjectors, such as the EpiPen, are pre-dosed for easy administration. The standard adult dose is 0.3 mg, while pediatric doses are 0.15 mg. Be aware that additional doses may be required for severe cases. Always ensure rapid transport following epinephrine administration, as symptoms can return after the initial dose wears off. While epinephrine is life-saving, it does have side effects. Patients may experience increased heart rate, elevated blood pressure, anxiety, dizziness, nausea, or headache. However, in cases of anaphylaxis, the benefits of epinephrine far outweigh the risks. Patients should be transported for continued monitoring to ensure they do not experience a rebound reaction after the medication wears off. Epinephrine should only be administered when signs of anaphylaxis are present. It should not be given to patients who do not exhibit symptoms of respiratory distress or hypotension. If the patient does not meet the criteria for anaphylaxis, supportive care and close monitoring may be all that is required. Epinephrine autoinjectors are designed for easy use in emergency situations. To administer, remove the safety cap, place the injector firmly against the outer thigh, and press until the device activates. Hold it in place for about 10 seconds to ensure the full dose is delivered. After administration, massage the injection site to help distribute the medication. If symptoms do not improve within a few minutes, a second dose may be necessary, based on local protocols. Always ensure rapid transport following epinephrine administration. After administering epinephrine, continue monitoring the patient closely for changes in condition. Some patients may experience mild side effects, including an increased heart rate, anxiety, or dizziness. However, in severe cases of anaphylaxis, epinephrine may only provide temporary relief. Be prepared to assist with ventilations if breathing worsens. Even if symptoms improve, all patients who receive epinephrine must be transported to the hospital for further evaluation and observation, as reactions can sometimes return after initial treatment. In some cases, patients may not have access to an epinephrine autoinjector. If epinephrine is unavailable, focus on providing high-flow oxygen, positioning the patient appropriately, and treating for shock if necessary. Keep the airway clear and be prepared to assist ventilations with a bag valve mask if needed. Rapid transport is essential, as definitive treatment can only be provided in a hospital setting. If the patient has an epinephrine prescription but does not have their autoinjector, follow local protocols for EMT administration or request ALS backup. Every patient experiencing an allergic reaction should be transported to the hospital for further evaluation. Even if symptoms appear mild, there is always a risk of worsening or biphasic reactions, where symptoms return after initial improvement. Document all interventions, including the time and dosage of any medications given, the patient's response to treatment, and any changes in condition. Provide a detailed handoff report to hospital staff to ensure seamless continuity of care. The key to managing anaphylaxis is early recognition, rapid intervention, and prompt transport.